rate of positive cases day over day. In the last 48 hours since our update, we have had 2,616 tested, 2616 tested, and as I said, 181 of them coming back positive. That puts us at a 6.92% new infection rate. That's higher than we were 2 days ago, and that is slowly continuing to tick up as well. We're now clearly and enduringly over that 5% threshold of new infection rate, which is, of course, alarming. And you can see very clearly here as well, also just the rate of new cases growing. The only good news here on this slide is we also, and you can see the blue part of this graph, from the beginning of the pandemic, we have been steadily working to and improving our testing capacity. And each day we are setting new records of the number of tests that we are able to do. So we must and we are and we will continue to work on upping our testing capacity as well as we continue through this second wave. The projections of total cumulative cases, you can see here, even in the best case, we're headed towards more than 5,000 cumulative cases by the end of this month and potentially reaching 6,000. What we do between, really in the next few days will determine that, as well as ultimately how many are hospitalized and how many we lose in the midst of this second wave of the pandemic. Hospital capacity looking forward, this is more and more important as we do start to see our case totals climb, our hospitalizations climb, and our fatalities climb. What our ability is regionally and in the state to treat those that are the most sick in the hospitals is really now the most important thing we're focused on again, and that the governor is focused on. Currently, we are in good shape here with 16 hospitalized, 2 in ICU beds and on a ventilator, and more than sufficient need. Where this is headed, though, and I think we're going to see more definitive guidance from the governor and New York State likely tomorrow, as we shift clearly now into the second wave, the main area of focus that the governor has already talked about and that will remain focused on is we can't get to a situation like we were back in April where we're getting dangerously close to surpassing our hospital capacity to treat those that are most sick. So any potential restrictions that may come from the state are really going to be primarily tied to that. Meaning if we are starting to get close to a level where we might run out of hospital capacity again, that is what would trigger the governor and the state to impose any additional restrictions on our schools or businesses or other parts of what we're doing, which makes a lot of sense. I think the strategy of looking at microclusters and applying yellow, orange, and red zones, that made a lot of sense when we did have clearly contained clusters. As I said on Tuesday, we are now at the point where we are in a community spread situation again, and therefore it's no longer practical to have those targeted microclusters, and we're now going to need to shift more to that mode of those restrictions being tied to hospital capacity. So we'll likely get more guidance, and we're waiting for that from New York State in the next either 24 or 48, 72 hours. But in the meantime, we still very much know what we need to be doing here in terms of actions, and we'll talk about that a little bit more in a moment. The other items that I wanted to quickly hit on beyond the immediate health aspects are what else we're doing as a county government, but really as a community to get ready for what is going to be a difficult winter, and to do everything we possibly can to support each other, to support our neighbors and our friends and our colleagues, and especially to support the most vulnerable among us. So in that vein, there's a few different things we're doing there. Number one, and I think really at this point, an existential situation is the fact that for nearly 10 months, we have asked so much of each of you, of each of our residents, in terms of restricting our daily lives, affecting our businesses, our families, our work, our schools. And early on, Congress marshaled the spirit and the courage to come together and provide serious federal relief, which really helped us get through that first wave. As we shift into this next phase of COVID, and now clearly it's a worse second wave than the first, it's even more important that there is serious federal relief for individuals in terms of unemployment and economic support, for businesses in terms of the PPP program and business grants and loans, and for local governments that have been on the front lines of fighting this, of sending out public health nurses and building testing centers and coordinating vaccination. So yesterday, I joined 12 other county executives from across New York State, a mix of Democrats and Republicans. And believe it or not, we were all saying exactly the same thing, which is we are in desperate need of federal relief. There has been some encouraging signs of a renewed sense of bipartisanship or nonpartisanship. We're seeing more discussions happening in Washington in the last few days that hold out hope for a prospect of significant federal relief, around on the order of $1 trillion total. All of the county leaders that got together yesterday talked about the fact that some amount of that needs to go directly to state and local governments, that it absolutely needs to go to individual Americans that are under so much pressure right now. And so what I basically said, to be blunt, was it's, especially as we head into this phase and this winter, it is now time for Congress to put up or shut up. We've been talking about this second wave of relief for months, and now it is time to do your job, roll up your sleeves, negotiate and cooperate, and get relief to the Americans that desperately, desperately need it. And everyone here on the front line knows viscerally how desperate that need is, because especially in county government, we serve the most vulnerable members of our community: seniors, children, those with developmental disabilities, those struggling with needing a job or struggling for housing or food. So we feel that urgency every single day, and that came across yesterday. I do want to make clear and thank our New York delegation in Washington, especially Senator Schumer, especially Congressman Delgado, and of course Senator Gillibrand and our other representatives in the House. Again, across party lines, they are all pushing for this. And I was encouraged yesterday in our session. Several of the Republican county executives directly said, "Hey, to my fellow Republicans in the U.S. Senate and to Senator McConnell, time to step up and do your job and get this done." So at the local level, we're all coming together because we're closest to the problem and we feel the pain. And before the Congress goes home for the holidays and goes to their nice warm home with their family and has a meal, I want to remind them to think about the families here and across the country, where we have record-setting numbers of COVID cases and deaths, where we have people hungry and without jobs and in need. And this is the time for the federal government to act. So I will continue to push for that help. I ask each of you to continue to push for that help. And I want to thank again, especially Congressman Delgado and Senator Schumer and their teams for pushing on this. That's happening at the federal level. We're going to continue to fight at the federal level. But at the local level, there's also more that we're doing and that we're going to continue to do. So one of the biggest needs we know will be to have the backs of our businesses and our small businesses especially. We have 7,000 about businesses in Ulster County. And for so many of you, and I get this having been a business owner myself, this winter is really going to be a tough winter, really a make or break kind of a winter for so many businesses that are just hanging on. So I want you to know that Ulster County has your back, and we are really stepping up our efforts for our local businesses in a few different ways to make sure that we're expanding that support. So we're partnering, our economic development team is partnering with others in the area, specifically our Small Business Development Center, which is federally funded. and our Ulster Respond team, which is something that we've funded through our Economic Development Alliance. With those partnerships and bringing additional staff on board, we have essentially doubled our team of experts and staff that are here to support you, our business owners. And so with that additional team in place, we can now be even more responsive to individual needs of individual businesses and ensure that if we haven't already, that we will have a 24-hour less response back to you and to your business needs. Up on the screen is the phone number specifically for our economic development office. And I put that up there and want to make clear that this is personal for us in Ulster County. We know so many of you business owners. We know your businesses. We are customers at your businesses. And we think of us, please, and me as really your first point to go to when you are in need. And there are 4 specific areas or categories of support that we have. But really, for any needs, if we can't help you, at least we can direct you to that resource at another place or at another level. So please don't hesitate to reach out. Every day we get several, sometimes dozens of calls, but we have the capacity to take those calls and get back to you. 4 big categories of support. If you're out there as a business owner and asking, okay, well, what can you actually do for me? There's a lot of words on this slide, but at a high level, we can provide funding and dollars and capital. We can help you with the safety precautions that are needed to open your business safely. We can help you with business planning as you need to pivot or adjust your business plan given the impacts of COVID. And we want to continue to foster a sense of community and businesses sharing what they're learning and what they're doing with each other so that we can all kind of support each other and share good ideas that have worked. In particular, on the funding side, which I know is the most urgent need as revenues are dwindling, our whole team, which again we've now effectively doubled through these partnerships, are experts in getting access to state and federal programs for loans, for capital loans, in some cases for grants and working capital, and also counseling on debt forgiveness. I know that the financial pressures are, of course, are the most important and the highest pressure point. So please, don't hesitate to reach out. Again, the number for our Office of Economic Development is 845-340-3556, 340-3556. Final update in terms of how we are continuing to remain proactive in the face of the second wave. I've talked a little bit about our vaccine planning efforts. We are continuing to lean in on that, and planning continues to progress on that front. On Tuesday, I announced what I think will be a really important effort, which is creating a true coalition in Ulster County to build trust and confidence in the vaccine, in our ability to distribute the vaccine quickly and safely and fairly and equally to everyone in the county. So we're continuing to build that, and we'll be announcing as members join that, rolling that out. And if you want to get involved, please reach out on that front. On the sort of logistical front and the operation of distributing the vaccine, planning continues and has really actually picked up in the last few days as we're getting more guidance from New York State. So just a little bit more detail there for all of you so you know what we know. We expect that phase 1 of the vaccinations will start probably next week, potentially this weekend. Phase 1 will focus generally on 2 categories of those at greatest risk and greatest need. Number 1 are essential healthcare workers who are most at risk and most exposed, whether it's via the type of job they do or where they're working. So that list is being built in coordination with the state and our health department and really managed by the hospital networks. So the hospital networks in the county and in the region, New Vance and Health Alliance Westchester, Ellenville Regional, they will be the point of receiving those vaccines, storing them, handling them, and administering them to that critical healthcare workforce as part of phase one. The other element will be the distribution, as the governor has talked about, of the vaccine to seniors and critical healthcare and other workers in our long-term care facilities and our senior facilities. That aspect is actually going to be managed primarily by CVS as a partner that has, of course, a national network of ability to store and distribute. And those pharmacies will actually be standing up teams, once again in coordination with us, to bring those vaccines directly to our different senior care facilities across the county and the region. So the planning is going well and progressing, and we're really ready to execute that phase one of vaccination as early as next week, which, if we take a step back, really is incredible, and a huge credit to the researchers and scientists who've developed it, to all those involved in figuring out the plan to roll it out. This is going to be extremely complex and difficult, and as we shift into phases 2, 3, 4, and 5, I'll continue to share the details of what that will look like here in the county with you all. Phase 2 is where we'll expand into a wider set of essential workers, more healthcare workers, those that have to be at work to keep our economy and our society running. They will be prioritized in that second wave. And generally, depending on kind of, just as we said in phase 1, who you are and where you live, you may be receiving that vaccine from your primary care physician. You may go to a hospital to receive it. You may go to a private CVS or Walgreens or other pharmacy, or you may actually receive it from an Ulster County team at one of our point of distribution sites. And we are working that through to make sure that everyone in the county has access fairly and equitably, and to make sure that throughout we can communicate that plan clearly and make it as easy as possible for us to get this done rapidly and safely. So more to come on that front as well. I know that was a lot, and I know that we had some technical glitches up front, so I appreciate everyone bearing with us. We will be posting this stream on our Facebook page. It'll be just obviously time delayed and not quite live. We are sorry for the technical glitch there, but the awesome team at Radio Kingston is working now as I speak to get that set up and running, and we'll work to address it going forward as well. As we close, please remember that at the individual level, you and your family and those close to you, we are the ones. That's what it boils down to. Each of us individually are the ones that can control our fate and how quickly we blunt this second wave. So the decision that every single one of us makes individually to put on a mask, to maintain distance, to wash our hands regularly, to not get together in large or unsafe gatherings of people, those decisions have a ripple effect. Right now, the virus has this sort of exponential spread effect. We need to individually counter that by creating a sort of a reverse spread of doing the right things and taking those precautions and being thoughtful about others. So please continue to do that, and thank you to everyone that is doing that. Thank you also to all of our frontline workers. We continue to see you and appreciate you and honor you for putting yourself on the line for us, and we know that heading into the winter, you are all going to be tested again, and we thank you for that in advance as well. Finally, as the pressures continue to grow and the weather gets colder and so many challenges mount, please know that, as I said, the county is really here for you, especially for those that are experiencing challenge right now and uncertainty and fear. You can start by calling our Recovery Service Center. That number is 845-443-8888. You can also go on our webpage to get all the latest data and information and all these different resources for businesses and so on. All that information is on our great COVID-19 portal. With that, we will wrap. Again, all this will be available on our Facebook page to rewatch or to share with others that may have missed it. If you're hearing from someone wondering what happened, if you don't mind shooting them a note or a comment saying yeah, there was a glitch today, but it's now posted on the site. We would appreciate that. Thank you for tuning in. Our next scheduled update will be Tuesday at 2 p.m. In the meantime, please stay safe and healthy and stick together and be resilient, and we will get through this. Thank you.